Good afternoon, everybody. Today is Friday, February 18th. I'm Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. FalmouthMA.gov is our website. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. Had a pretty good week this week. We did hit the 4,000 mark for case counts. This is PCR tests. That's what we track as far as the case count number. But the cases have gone down to 32 PCR tests for the week, 11 probable tests. Again, that probables mean rapid tests done at places like Convenient MD and so forth, not home tests. Those are going to be unknown. Falmouth's 14-day incidence rates dropped from 42.4 to 26.8, and that number continues to drop. I'll talk about that in a second. And our positivity dropped to 6.14, which was 8.8 the week before. So as far as our case counts, the chart I like to show, you can see in the far right, the cases dropped off just as fast as they came, and now we're down in sort of where we were in the fall of 2021. So that's, and then when we talk about positivity incidence rate, I'm circling it with the cursor. I hope you can see it, but it doesn't capture the relatively good week we had this past week. It's going to capture the two previous weeks, so we're up above 50, between 50 and 100. And it'll catch a little bit of that higher number as well when they do their case count. They just happen to pick different dates. What I'm saying is those numbers for positivity and incidence rates are dropping because of it'll start capturing the lower case counts shortly. As far as the flattening of the curve, this is the chart we show for that. The closer the dots are together and the flatter, the better. And you can start seeing that we've got it flattened back down with lower case counts, and that's good. Really bad is when they're spread apart and going up really fast. This is an old chart from Barnstable County, but this is the newest one. This is 210, but it's going to show similar numbers. I just didn't get an update from the county early enough when I'm doing the presentation right now to update the chart, and that's as true as also for hospitalizations. I have the older number, but 2,000 cases, 2,326. It was 2,600 and something last week at the same week. Positivity for the more recent 7 days is 2.76. We're working our way towards that, but we're not nearly that low at this point. Under 1,000 patients hospitalized. So you look at the trends, it's still on a trending downward. Everything's trending downward, which is great. And so that's where we are with cases statewide, county. It's all continuing to fall for cases. Hospitalizations, again, 2.9 was the most recent number. I don't think there's anything that's been changed. I just get this update with the county report. I just didn't happen to get one. I'll probably get one about an hour from now, and then it's too late to do the presentation. So that's where we are with it. If I do get a new one, I will post it on the website with the newest one. When I do the website update, I usually do it just, probably in a few hours. Usually right around 3, 4 o'clock is when I do it. Incidence rates among the towns on the Cape. Again, the time frame it's capturing is January 30th to February 2nd. So that comes in right around in this sort of range in here. So it's still picking up a little bit of the higher counts that we had previously. But that just means that next week and so forth, it'll just keep going down. So 26.8, which is this number, what does that mean? If all these towns are adjusted to 100,000 person population to make them all relative to each other, our average would be, if we had a population of 100,000, it would be 26 daily cases. So since we have about a population of a third of that, divide that number by 3, and then you go. So, that number is closer to 8 or 9, right around 9 daily cases in that time frame between the 30th and the 12th. Some towns are doing a lot better. Some towns are doing worse. We're sort of in the middle. Again, trending downward, but, still there. Definitely still there. Positivity, same thing. We're in the middle, working our way back, and that's where we are with that. So, again, these numbers should be down again next week, pretty drastically. Again, my favorite slide to show is fully vaccinated individuals. Of the 440,888 breakthrough cases, the hospitalization rate a little bit higher than last week, still well under 2. It's at 1.6. I think the lowest it goes a little under 1.5. And less than 1% of all breakthrough cases will result in death. If you go on the far right, of all people that were vaccinated in Massachusetts, 8.4% of them have had a breakthrough. Of those, 0.13% of all people vaccinated in the state. Of all the people vaccinated in the state, 0.13 hospitalization. So Omicron being a bit weaker, plus the facts of vaccines and boosters work, that's where we get to enjoy these numbers. Vaccination rates, again, robust vaccination rates. We gained 284 doses over the week, 166 boosters, 73 second doses, 45 first doses, so 45 people elected to get vaccinated for the first time, and 166 elected to get boosted, and 73 decided to get their second dose for the full two-dose series when you're using Pfizer or Moderna. Again, 84% of all our residents are fully vaccinated, so good numbers. Vaccine availability has not changed. There's plenty. That's not a high, 200 a week is easy to handle. Pharmacies, the community MD, community health centers, the Barnstable County Health Office doing it once a week. The community college still has one as far as I can tell. To be 100% sure, because sometimes things drop off that I'm not aware of, you would just go on barnstablecounty.org. Go to the Barnstable County Health and the Environment website, and they'll have the most updated information when it's got to do with Barnstable County and the community college. Homebound people, if you know someone's homebound, haven't been vaccinated, haven't been boosted, again, we have the VNA. They'll come out and do a house call. I have not had anybody call in a while, so I like to say that on every update. And I haven't scheduled any VNA clinics at the Gus Canny just because the numbers, there hasn't been a scarcity of available slots for boosters. So it doesn't necessarily need to do it if CVS has 10 open spots every week or every couple days or whatever. So, we'll keep an eye on it, and then we can always add a clinic in if we feel we need to. Testing, school-based has their pool testing and home testing. Community MD still doing the testing, the hospital, the home kits, the Cape Cod Church. Very few people are utilizing you check the Barnstable County Health and Environment website again, but the fairgrounds, we're not getting a lot of activity for testing there. We do still have to stop the spread at the Melody tent. You have your home kits, so there's still a fair amount of testing available. Isolation kinds, nothing has changed with that, so I think I'm just going to skip over that. Any direct questions, you can always call the health department or email us, and we can answer any direct questions you may have with this. These just comes right off the state's website. Vaccination records, MyVax records, I've had some difficulty of getting that. I can't really help you with that per se. You should be able to just put your first name, last name, and your information, create a PIN number, and submit to get an electronic vaccination record. I can't really help you with that. It is a state, so probably the 211 number might be the best number to call to work on that. I don't really, go on the website, and there probably will be a phone number. I believe it would be 211, and try to get your access for your Vax records electronically. I didn't change this chart. It's all purple. It's all Omicron. Nothing's really changed on that front. I have a call every week. All the health agents have a call with Dr. Katie Brown, and Katie is the lead epidemiologist at the state. She's awesome. And she doesn't see anything coming down, anything new or anything alerting at this point in time. Obviously, that's definitely subject to change. We thought we were out of it in June of last year, and then Delta showed up in July. So but where we are right now, there's no variants of concern showing up at this point. And when they do, you can see how fast they take over, orange being Delta and purple being Omicron, how fast that flipped over in a matter of weeks. That can obviously happen again. If it stays Omicron, mainly an Omicron around with the amount of people that got Omicron over those few weeks to a month. Remember, those numbers I show you are PCR tests. They don't count home kits, and so there's some number way higher than that. If it stays Omicron, there's going to be getting the diseases. They feel about at least a 90-day sort of immunity with the same variant if you've gotten it. So that plus our high vaccination rates, we might be doing well for the rest of the spring. I hope so. Only time will tell, but that's what we are with that. So it's good to say when she said that she didn't see anything coming down the pike, and we'll take it when we can. Face coverings, there have been some changes with that. Townwide mask advisory for all public indoor spaces. That would be, restaurants, hotels, things of that nature. The school committee voted not to implement a mask mandate after the state expires, the state mandate expires on 2/28. I concurred with that as Dr. Parkinson, the school's physician. Let's reap what we sow at this point in time. We have great vaccination rates. The hospitals aren't burdened. A lot of these guidances and mask mandates and so forth were supposed to be temporary in 2020 when we got a vaccine and we got treatments, and we're all kind of there now. And, again, I felt it was time. You can always still have your child still wear a mask. I just thought it was time. Look, maybe this fall there's a new variant out and we have to re-look at that, but we know how to flip the switch on and off. I just think when you can switch it off, you should switch it off. And that's where we are with that. Town buildings, not schools. The select board adopted a mask requirement in the heat of Omicron. It's still in effect. It hasn't been voted out at any point yet. So we still have it in town-owned properties, not schools. Schools operate independently. I did check into that. But the schools, so they did not implement that on this past Tuesday. So coming March 1st, when you come off of school vacation week, then the masks will be optional at schools. I think it's time to give kids a break with the mask requirements. As far as our rates of infection, we're going to be high. It's really hard to get out of high. I mean, you're really going to get case counts down into the, nearly, low teens to under 10 a week to get into that moderate and low, because you're taking that daily incidence rate and multiplying it by 7. So even you'd have to have sort of a relatively real low case count. I mean, we're working our way. We're much higher, but we need to get that daily rate, our incidence rate. Probably a third of what it is to get into the moderate, or more than a third, looks like. So a daily rate would have to be somewhere around 8, which would mean somewhere, let's say 9, 3 cases a day average for Falmouth or less, and to get to a more of the moderate area. That's a real low infection. We do generally get, the summer, respiratory viruses aren't any different. This isn't any different for most of them. When you're wearing shorts and it's warm out and so forth, the cases generally are lower than they are in the winter, right? We all know that. So if we don't get any bump over the spring, it'll be nice to have several weeks to cover, even several months until we get into the hot weather without a lot of cases to really drive it down. That would be awesome. So. But we're in the high category. It'll take a little time to get below high. Our positivity dropped from substantial to moderate. And I wouldn't be surprised if we're under 5 next week. So if we are, it'll drop into the low category. Hospitalizations, I haven't heard anything different. Sorry, it's an older chart. It's just what I have. And, of course, our vaccines. So that's some of the metrics that you use and some of the decisions that you make. So case counts have significantly tapered off. Hopefully they stay that way. The cases are all Omicron. The hospitals seem to be doing okay. Consider, when you make your decisions, face coverings, you do your social distancing. Each individual needs to take their own health into account, and when they make the decisions. We still have a mask advisory for all in indoor spaces. The only place that would be required, again, would be town-owned buildings. Vaccine is eligible, to anybody over 5. The boosters are there. There's plenty of openings. So that's my recap. We'll take this good week, and we'll see what happens next week, and so on and so forth. So this is my update for the week, and I'll see everybody again next Friday. Thanks.